There are said to be about 7,600 certified geriatricians in the U.S. right now, one for every 2,500 Americans 75 or older. But by 2030, that ratio will change to one for every 4,300. Numbers like those have many people worried that aging baby boomers will not have access to adequate care. Correspondent Molly Hanneberg has more in tonight's America's Future report.
It's a little painful right there.
Third-year resident Dr. Adam Posner is doing a rotation in geriatrics. He says older patients are a wealth of wisdom and perseverance.
And also, geriatric patients are fantastic as far as the stories they have to tell.
And their numbers are growing. In 2011, the first of the 78 million baby boomers will turn 65. By 2030, those 65 and over will almost double from 37 to 70 million, reaching about 20% of the population. But look at this. Only 1% of all doctors now are certified geriatricians, specializing in treating the elderly. It is and has been a growing worry for those in medicine.
The actual number of certified geriatricians is currently going down each year, not up.
Not a very sexy field to go into. It's not well reimbursed. It does require additional training.
Part of the problem? Medicare doesn't pay as much as most private insurance. So a geriatrician makes about $15,000 less than a general practitioner. And that's rough on a new doctor with big loans to pay off.
You know, many of us, when we leave medical school, we have on average, like, over $100,000 in debt. So I think getting or having some incentives to cover some of that debt is definitely important and is part of the solution.
Dr. Jack Rowe, who helped craft an Insitute of Medicine report warning about a shortage of healthcare workers for the aging population, says changing Medicare is key.
If we can get Medicare to pay physicians more if they have certified competence in care of the elderly, that would go a long way.
In the meantime, medical schools such as Johns Hopkins have increased their focus on geriatrics.
In the last 4 or 5 years, we've ramped that up dramatically. Now that the boomers are just around the corner, we've integrated geriatrics into many different parts of the residency training.
Hi, Ms. Wang. My name is Lydia. I'll be your nurse today. How you doing today?
Experts also predict a need for 800,000 more nurses and 200,000 more nurse aides to help with the boomers.
People need to either join us in geriatrics, or they need to make sure that they have enough geriatric content in their curriculum and in their background to do the job well.
Dr. Rowe says only half of the geriatric training positions are filled each year, and 60% of those positions are filled by doctors from other countries who have come to the U.S. to study medicine, and they may go back to their home countries to practice. In Washington, Molly Hanneberg, Fox News.